Hi, I'm Dr. Dan Castascia with Sarasota Neurology, and we're here today to talk about matrix platelet-rich plasma therapy and the different conditions that you can use it for. Deborah's been kind enough to join us today to talk about her rotator cuff syndrome and how she was originally going to have surgery, but then finally ended up having matrix platelet-rich plasma therapy. Thank you, Deborah, for joining us today, and it would help our viewers to understand what happened to you and what was the nature of your rotator cuff. Can you tell us about that?
Sure. I just began having pain and discomfort, went to my doctor, did
Pain and discomfort where?
right here.
And that was when?
This was in 2014. I spent the better part of 2014 in conservative treatment, therapies, injections.
Did you have any injury or it just came on?
No injury, just happened.
So you had injections and physical therapy.
Mm-hmm.
Did that help or did it get worse?
No, it didn't get worse, but it did not get better.
So how bad was your pain?
Bad enough that it kept me from doing the most basic things for myself personally without pain.
Were you able to pick up a glass or your purse or anything like that?
Not without pain. And my purse, I began using my other arm because it was big and heavy. I carried things I needed in it for work.
And you are right-handed?
Yes, I am.
So you had limited use of your dominant arm.
I absolutely had limited use.
So after you weren't responding, you went to see a surgeon in 2015?
Yes, I did. I had a MRI in 2015.
And that showed a torn rotator cuff?
Yes, it did. Almost full thickness, as a matter of fact.
Full thickness, okay. Yeah, that's good. And then you saw a surgeon, orthopedic surgeon.
Grudgingly, yes.
And they were proposing to do surgery on you?
Yes.
And is that what you wanted to do, or
No.
did you think that was your only option?
Yes, I did think that was my only option, basing it on the information I was getting from my primary. I went to see him for a consultation, hoping that he would offer me alternatives to surgery because I have a great deal of experience with people having shoulder surgery, and I know what the recovery time is. And
How about the outcomes?
outcomes are not very good,
Okay.
especially with people my age.
Right. And so then you learned about matrix platelet-rich plasma therapy, and you did some research on that.
I did.
Went to our website.
I did.
That's PRPstopspain.com, and you can see that at the bottom of your screen. And so tell us about that. So you saw our PRPstopspain.com website, and you thought what?
That this had to be a better opportunity for me to at least try it.
To avoid surgery.
To absolutely avoid surgery. I mean, I can repeat to you what I just said about I know the outcomes and I know the recovery time.
So the recovery time after a standard arthroscopic shoulder surgery was told to you to be what?
9 to 12 months.
Months? A year?
A year.
It was going to take you a year to recover from surgery.
Mm-hmm.
And your understanding for the treatment with matrix platelet-rich plasma therapy, was there any recovery time, or what was your downtime with that?
My personal downtime was the day of the injection.
Just to come in and get the injection?
Come in and get it and rest because I was a little anxious the day of. The next day I went back to doing what I normally do.
Great.
Able to do all those personal things I was so concerned about.
So you canceled your surgery.
I did.
You even had it scheduled.
I had it scheduled twice.
Twice? Oh, so you were fully prepared to have shoulder surgery for your torn rotator cuff.
Yes, I was.
And then you canceled that after coming in to see me, and we did matrix platelet-rich plasma therapy on you sometime in June of 2015.
2015.
And how did you do with that treatment?
Excellent. Excellent. I have no doubt in my mind ever that I recommend this to everybody. Anybody and everybody who will listen to me.
So you did well. You regained the full use of your arm? No pain?
No.
Did the range of motion improve in your arm?
My range of motion is better than it was in 2014.
Can we see how that is in the right arm? Can you reach above your head? Could you do that before your treatment?
No, not without helping with my left.
Because of the pain?
Because of the pain.
Right. And did we have to send you for physical therapy or any kind of rehab or anything? So it was basically come in,
Get her done.
get the matrix PRP, and go home.
Go home. That's right.
And I saw you, 12 weeks later, and you were cleared up.
You saw me 2 visits, each 6 weeks, and
But that was just for a checkup.
that's right.
We didn't do any therapy or anything.
No,
And you've had no complications?
none.
And did you have any recurrence of your pain or torn rotator cuff?
No.
Do you feel completely healed?
Completely. I mean,
So if
99%.
if somebody was
complete?
asking you, well, should I have my rotator cuff operated on, or should I consider getting matrix platelet-rich plasma therapy, what would you tell someone?
Absolutely go and see Dr. Casasilla, because he can do this. He fixed my shoulder.
Right. That's great. And I think you've had some experience with people you know that have had the matrix PRP for also torn meniscus in their knee as well.
And plantar fasciitis, both pre and post surgery.
Versus PRP.
Exactly.
And how did the surgery patients do compared to the PRP patients?
They do not do well. They do not. Neither one of the ones that I am personally familiar with recovered post-surgery until they had PRP.
So their surgery outcome was not good.
Not good.
But PRP even fixed them after they had the surgery. And
yes,
the persistent pain.
Yes.
And they did well.
Yes.
Well, that's great. Well, thank you so much for coming in today and sharing your story with us. I really appreciate it.
I thank you.
Okay. Good. So if you have a torn rotator cuff or torn meniscus in your knee or even plantar fasciitis, you may not want to consider surgery because the outcomes, as you heard Deborah say, can be poor and you can have persistent or even worse pain. The nice thing about matrix platelet-rich plasma therapy is that we can treat you before surgery to heal your problem, whether it be in the shoulder, knee, or foot. But even if you have had surgery, PRP works very well to help eliminate the pain that you may have after surgery. So don't hesitate to call Sarasota Neurology at 941-955-5858 to schedule your consultation for matrix platelet-rich plasma.